Erectile dysfunction, ED, afflicts nearly half of all men over the age of 20 in the United States. In this video, we'll go over 7 methods to help alleviate ED and potentially even prevent it from occurring in the future. 1. Watch your diet. Maintaining a healthy weight, low cholesterol levels, and blood pressure are important for healthy blood flow and to avoid things like diabetes, which could potentially cause ED. You should stick to a balanced diet that includes green vegetables, lean proteins, and other healthy foods. Significant weight loss can result in dramatic rises in testosterone levels. Testosterone is the primary male sex hormone that plays a role in many of the functions of the body, such as preventing bone fragility and osteoporosis, growing hair on the body, helping to boost muscle mass, increasing self-esteem, and of course, enhancing the sex drive. If you're overweight or borderline obese, take preventative care to institute a healthy diet and avoid toxic, sugary, and excessively fatty foods. 2. Exercise daily. Exercising not only increases blood flow, which is imperative to erectile functions, but it also helps to release hormones into the body, such as serotonin and dopamine. Serotonin plays a major role in the biology of ejaculation and proper erectile functions. Dopamine also plays a big role in erectile function. 3. Avoid using drugs. Illegal and recreational drugs, along with other prescription drugs, can play a significant role in helping to bring about erectile dysfunction. They can also inhibit your body's ability to feel sensations, and it can certainly dull the senses of arousal. Keep in mind that medication overall can have an impact on erectile functions. These include antidepressants, selective SSRIs, and SSNRIs. In some cases, these impact overall hormonal and chemical levels, changing of the concentration of dopamine, serotonin, and prolactin in the brain. 4. Avoid alcohol consumption. Studies have found that men with severe alcohol dependence run a serious risk of developing ED. Chronic abuse of alcohol has been long known to create dysfunction in sex. Ongoing abuse of alcohol can also bring on other diseases, along with severely impacting the psychology of the mind. In turn, stress increases on those who abuse alcohol, especially at the expense of other things in life, such as their careers and their families. 5. No steroids. Anabolic steroids are often abused by bodybuilders and athletes trying to get into peak physical condition. However, the usage of steroids can also create the onset of ED, especially without supplementing testosterone during use. Not only do steroids help to shrink the testicles, but they also make it harder for the body to create testosterone. 6. Stop smoking cigarettes. Aside from being one of the worst possible habits, smoking cigarettes can also interfere with your erectile function. However, most people wonder whether smoking actually has an impact on erectile function. In 2014, the US Surgeon General warned that ED was one of the conditions that can be caused by smoking. 7. Reduce stress levels. Not only can stress bring on ED, but can also self-propagate it as well. When you're stressed and it causes ED, it creates more stress about ED. And getting an erection at the right time and maintaining it becomes a stressful scenario in and of itself. In fact, for middle-aged men, stress, both in personal and professional realms of their lives, is the leading cause of ED. And in addition to these preventative measures, you can also try our pharmaceutical-grade medication right now that will rush to your doorstep absolutely free. Visit our site today to get an online prescription. And if you enjoyed this video, be sure to like, comment, and subscribe.